Hello, everyone. Thank you for joining us this afternoon to talk about blood pressure measurements. As you know, we've been working, at the end of each year, we report a number of metrics to CMS for MIPS and CPC reporting, along with a couple of other payers that like to look at our data. We're going to talk a little bit about the blood pressure metric. Approximately 3 weeks ago, when we ran our measure, we noticed some inconsistencies in the blood pressure measure, and after doing a little digging, we discovered some things that we needed to update. So we're going to run through a couple of things with you, let you know about what we did and how the metric is defined and reported, and some things to think about for 2019. First of all, this is a CMS measure. It's number 165. It's targeting patients who have a diagnosis of hypertension who are 18 to 85 years old and whose blood pressure is considered adequately controlled. That means their last recorded blood pressure during that measurement period was less than 140/90. So some key elements to this metric and what makes this metric work for reporting is that there needs to be a diagnosis of hypertension in the problem list. The problem list needs to have a noted date within the first 6 months of the measurement period, or this year. That would be January through June of this year, or any time prior. Any time in 2017, 2016 would count as a noted date. Blood pressure must be recorded during an office visit. And I know this may cause some concerns about nurse visits, but just remember you're probably going to have multiple office visits during the course of a year. And then the diastolic and systolic blood pressure must be less than 140/90. So this is from the American Heart Association. It shows the stages of blood pressure metrics, and you can see where we want to target our patients is to be in the blue box and have blood pressures reporting less than 140/90. Those two other metrics that are listed on this box are considered high blood pressure stage 2 and a hypertensive crisis. This map shows information from the American Health Rankings report, and if you can see Oklahoma, it definitely shows us as having a 37.7% of adults who have been told that they have high blood pressure. I'm sure you're not surprised to see Oklahoma in the darkest blue possible in this area. This took some of the data from one of those studies and indicated that in 2014, in that measurement period, Oklahoma had the 9th highest rate of hypertension among all of our states. And if we were able to control that hypertension, we could reduce the state's cardiovascular mortality by 9.6%. Certainly a goal worth striving for. Here's just a graph that kind of shows those trends over time on what has happened in these reporting of patients who've been told they have high blood pressure in our state. I want to go back and kind of focus on that word control so that we know what we're talking about, that blood pressure metric needs to be less than 140/90. So here's just a listing of our blood pressure metrics by clinic as of 12/31/18. We have done some updates. We have seen some adjustments made in those patients who were seen during that time period. We're going to talk about some of those updates that we did along the way. But you can see we have a number of clinics that are over that target area, as well as some that are near it. Okay, so what do we need to do first? The first thing we need to do in this metric is we need to make sure we have that diagnosis of hypertension in the patient's problem list in EPIC. So you can see on this screenshot, we actually do see the diagnosis of hypertension here, and we know that that's going to begin to count that patient in that metric. We need to have that diagnosis into EPIC within the first 6 months of the measurement period, between January and June again, or any time prior to the start of the year. So that diagnosis could have been made in the 2017 or 2016. as far back as what the EMR will record, and it'll count as that metric. If the patient has hypertension, but that diagnosis is not in the problem list, we need to add it to that problem list. And we do it within Epic pretty straightforward by clicking on the problem list, by looking at that add button, searching for your diagnoses of essential hypertension, and then pressing accept. You can do some additional types of hypertension specification here, and then click accept, and it will add it to the problem list. The next thing is the date of onset is important. We did some reports out of NextGen for patients in your clinics with the diagnosis of hypertension, and did pull the onset date that was recorded in NextGen. So when you record that problem list, essential hypertension, there's a detail button you click on to begin to add this note of the time. You want to document the onset date of the first report, date of diagnosis of hypertension. Epic will record today's date if you are entering the essential hypertension for the first time. So we want to adjust that date of onset to be when you knew the patient, or even when NextGen documented that diagnosis. Okay, so the last blood pressure taken during an office visit is less than 140/90. If it is less than that, this will be considered meets the measure. This is a screenshot of a vital sign of a patient, and it indicates that the blood pressure measure is 101/80, and that metric meets the measure. If the patient's last blood pressure of the visit was taken during an office visit and it was greater than 140/90, it does not meet the measure. And you can see here we had a patient who had a visit on November 20th. That was their last recorded visit in the year 2018, and their blood pressure was 146/80. So this does not meet the metric. So what can we do if our patient comes into the clinic and we have a blood pressure reading that is greater than 140/90 during the office visit? We have many clinics that record and retake the blood pressure during the patient's visit to see if that blood pressure will drop down. You can see here there was an initial blood pressure reading on the 7th of November as 135/91. That 91 would cause that patient to not meet the measure. So that blood pressure was retaken. The next blood pressure was taken and recorded as 129/74. You want to retake that blood pressure before the patient leaves to see if it comes into alignment. And we know that patients sometimes get a little stressed out about seeing their doctors. You guys recognize something called white coat syndrome, as well as other things that may be causing the patient to have an elevated blood pressure. We want to give them a little time to settle down if their initial read was greater than 140/90. Here's some quick, simple tips on how to get an accurate blood pressure reading. Mally Delk in our quality management department shares this with your medical assistants when they're going through orientation and as a refresher. So some of the things you know about, you want to make sure you got the right size cuff on your patient. Patient with larger arms or smaller arms may need a different size cuff. Obviously, if it's too small, it could elevate the blood pressure. You want to put the cuff on the bare arm if at all possible, not over clothing, certainly not over heavy clothing. You want to keep the arm at a heart level. Your legs should be uncrossed and supported, not dangling off the table. You don't want to have the patient talking or asking questions during that blood pressure read, and if necessary, you might ask them if they need to empty their bladder before you take their blood pressure. There are a couple of other things that impact that metric definition. One of them is a diagnosis of hypertension recorded anywhere. If there was a telephone call or a nurse visit or some other indication of hypertension, it will cause that patient to fall into the not met category. If you have a patient that's coming in to be assessed for the diagnosis of hypertension, you might want to record the diagnosis as high blood pressure prior to confirming that diagnosis of hypertension. A patient may or may not have hypertension, but will just have an elevated blood pressure for one measure. So, a couple of things going on. We have worked hard. The care managers within the clinics and some of your medical assistants have really put a lot of effort into trying to update some of the information that we pulled out of NextGen into Epic. So congratulations to the clinics on the left side of this screen. They achieved the maximum points for this measure of 8.33 report points. So Central Clinic, Claremore Family Practice, Claremore Internal Medicine. Dr. Wingo, I know you're on the call, so good job. South Sheridan, Dr. Gerhardt's clinic there, Midtown, Owasso worked really hard the past week in getting many of their patients updated. South Tulsa, Dr. Culp and her providers in that group in South Tulsa Internal Medicine, who always carry great metrics. But over on the right side, I want you to also see that those clinics who have improved their metric by more than 5% in the past 2 weeks. East 21st Street went up 6.5%, Bristow 9%, Broken Arrow South 6%, Catoosa 17%. A lot of this is because of that date being missed in the problem list or the diagnosis not being on the problem list. Cedar Ridge 8.8%, Claremore Family Medicine 19%, and Mingo Valley 15.8%. So congratulations and special thanks to some of those people that really dedicated their last week on getting these metrics up. Finally, just to review, remember the key elements to this metric: a diagnosis of hypertension in the problem list. The problem list needs to have a date associated with that diagnosis. It can be in the detail of the problem list, and it needs to be within the first 6 months of the year to be counted in this metric, or any time prior to the year. The blood pressure is counted when it's recorded during an office visit, and it meets the metric when that diastolic and systolic is less than 140/90. I reviewed a number of records, and as I was looking at those records, we were so close, so many times. I would say there's probably about 30 times that we were 140/85. We were 138/91, and encouraging you to retake that blood pressure during that office visit when possible. Thank you guys so much for listening today. I hope you have a great afternoon. Bye-bye.